Hi, everyone. I'm Dr. Jennifer V. Brown, your stroke specialist. And today we're going to talk about the use of elastic bands to strengthen the hemiplegic lower extremity during functional tasks. You may see some things for the arm also. Enjoy the video. So, I really do like using elastic bands because you can strengthen the muscles in three ways. Isometrically, where you hold the muscle in place against the resistance of the band. Concentrically, where you push out against the resistance of the band. And then eccentrically, you slowly let the band come back into place of its original length. Let's take a look at this video. So she's pushing out, concentric, she's holding it, and then she's letting it go back slow. Think of a rubber band that wants to recoil back in position. She's going back slow. So in this video, she worked her shoulder flexors, the muscles in the front here, and her tricep muscles, the muscles in the back of the arm to straighten out. And then those muscles, when returning to their lengthened position, were working eccentrically. And this is an open chain task, meaning even though her hands were fixed on the PVC piping, she didn't have her hands in a fixed position and she was moving her body on her hands. Let's look at this open chain exercise to improve dorsiflexion. Take note, the resistance, meaning the TheraBand, is not at the forefoot. Notice I start off and you see the video as an isometric. I will play it again. They are holding the knee up and then they're focusing on lowering down slow. And during that isometric hold, did you see how much dorsiflexion there was in the ankle? Imagine if you had the shoe on, you're limiting the foot's ability to let the foot move up. Okay, so this is why I do exercises with the AFO on, the AFO off, with and or without the shoe. And I put the resistance more proximal, the distal thigh, to recruit all things flexion in the leg, hip flexors, not working so much the hamstrings, the knee flexors, but then I was really able to turn on the dorsiflexors. And that should tell you sometimes it's the shoe itself, not just the brace, that may be limiting the movement of the foot. Hence, that's why I put non skid material on the floor and I have my clients walk barefoot when appropriate. So now let's look at some things for the hemiplegic arm. So here I have the TheraBand wrapped around the body and it's restricting the less affected arm from moving out and compensating when trying to move the left hand. And I took my hand and I put the hand in place in that hemiplegic arm. And I said, I want you to just hold it here. You don't have to do any work about moving it, but just hold it here. Sometimes isometric work is the easiest work to just stay in place. And then it could come back to his body slowly, working eccentrically for those muscles who had to hold it out in place. And in the bottom pictures, I have functional grip. Maybe I have proximal weakness. And so I am doing things in a diagonal. I can engage my core. I can go out. So when I go out against like this, I'm really working scapular muscles. And then when I'm out like this, I'm really working scapular muscles. Sometimes the arm cannot move well because of weakness in the scapular muscles. Remember, when I raise my arm up, the scapula has to rotate up. It only elevates when you're doing this. And I see so many people doing this exercise, but when you want to get the arm up, the humeral head goes down into the glenoid fossa of the scapula. So sometimes we're training the arm wrong, and the use of the TheraBand really helps to stabilize and strengthen the scapular muscles attached to that bone on the back for stability when you just need to do this, and for arm raising. You need upward rotation, and depending on the plane of the arm, protraction. That's very important. You need more of those things as opposed to just scapular elevation. And I think the TheraBand is an excellent tool to make that happen. So now look at this. I have someone kneeling in the chair. Why? Maybe they have an extensor synergy pattern, and I want to lengthen the rectus femoris that crosses the hip and the knee, as well as the quads that start in the thigh and cross the knee, and strengthen the gluteus maximus muscle. All right, so keeping the trunk upright. The glute attaches to the pelvis, and which is connected to the trunk, and I can keep it upright. And I'm strengthening her core by having her push out and raise up. Sometimes I wrap the TheraBand around the arms, sometimes I do not. So that the two top pictures are open chain, whereas the picture on the bottom where her hands are fixed and now she has to lower her body slowly against the bands because they really want to come together. And then she has to concentrically push up. So right now you see her in the holding pattern and notice her left elbow is not getting straight. And notice how I have the wrapping on the left arm different for the right arm. I'm trying to facilitate extension of that tricep, right? And so she's isometric hold, slowly lowering down, and concentric push out. In these pictures, I have the TheraBand wrapped around her leg. Now, this is a closed chain activity because the body is moving forward and loading the feet in standing. And then she has to weight shift to her right side and take a step with the left leg. Now, depending on how I have the coil of the band, it can facilitate hip flexion and keeping the knee straight. Maybe I'm just trying to work on the hip flexors and there's no need to make her do the extra work of bending the knee. But notice I have the TheraBand fixed where it can pull the foot up to neutral and clear the foot. I really want to work on stance phase as she gets up onto the stairs. So she's going to put her right leg up first, and I don't want her to collapse into knee flexion. So that may be a weakness of the calf muscle, eccentrically, a weakness of the quad muscle, eccentrically. And if her trunk was to fall forward while she is trying to put her right foot up on the step, that would be a weakness of the gluteus maximus. And to facilitate that, I could wrap the TheraBand around her buttock muscle more and make sure it ends around the greater trochanter and wrap around the thigh into internal rotation, which facilitates extension back around the knee and then down towards the back of the calf. I could put an X in the back of the calf to help facilitate concentric work, and then it has to go down slowly and then come back up against the resistance of that band. Okay? So these are some of the clinical questions to ask. Is the elastic band the right tension based on the muscle strength? All right. And did you test that muscle strength isometrically, concentrically, and eccentrically? Because if it's a stronger muscle and may have some sensory issues, you may want to use a less tension band, like the colors yellow, white, the lower colors in the spectrum. If the muscle's really weak, maybe you have to go up to the higher colors, green, blues, the grays. And then what's most important, and people don't think about this, is the elastic band the right length for the lever arm and the length of the body segment? Because you got to be able to pull out and allow the muscle to do the work. All right. So it has to be the length from here to here. If that's what you want the tricep to do, and then come back slowly. If you're interested in a course about using elastic bands for strengthening post stroke, go to Motivation CEUs for my course about that. Remember, I'm your trusted source for all things ankle foot orthoses and stroke neurorehabilitation. And don't forget the references. We have to use the evidence in order to improve practice as innovative, creative, and knowledgeable clinicians. Thank you so much for watching this video. Like, subscribe, and share.